We are now going to open the discussion on agenda item 7, the regional action plans for ending AIDS and the epidemics of viral hepatitis and sexually transmitted infections 2022 to 2030. And agenda item 8, tuberculosis action plan for the European region 2023 to 2030. I have the honor at this stage, excuse me, Czechia would like the floor.
Honorable Chair, Director, Regional Director, colleagues, I speak on behalf of the European Union and its member states. The EU and its member states are committed to achieve the highest attainable standard of health for persons with disabilities in the European region. We need this framework to achieve this, and it is our responsibility to make sure governments have it available. However, we can only ensure united adoption if we are able to negotiate and to hear each other's views. Only then we can put our differences aside and reach consensus. This opportunity was not achieved. Unfortunately, we have reached the point where we lose a very rich and comprehensive resolution text that was the combined and very significant work of both the Secretariat and Member States. We are greatly concerned by this, as the text lost references to essential evidence-based services that are of great importance for people with disabilities. As per the new European Consensus on Development, the EU remains committed to the promotion, protection and fulfillment of all human rights and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development and the outcomes of the review conferences, and remains committed to sexual and reproductive health and rights in this context. Having that in mind, the EU reaffirms its commitment to the promotion, protection and fulfillment of the right of every individual to have full control over and decide freely and responsibly on matters related to their sexuality and sexual and reproductive health, free from discrimination, coercion and violence. The EU further stresses the need for universal access to quality and affordable, comprehensive sexual and reproductive health information, education, including comprehensive sexuality education and healthcare services. We very carefully drafted a proposal to add it to this resolution text. We remain our position in this regard, despite we lose it in the text. It should not be forgotten. Thank you.
Merci, la Czechie.
Thank you, Czechia. I give the floor to Israel.
Thank you, Chair. Israel would like to explain its position. We are pleased that we have just adopted the framework of action. It is much needed. The many statesmen we have heard during the session yesterday amplify the urgency for concrete action and a change in mindset in order to achieve the highest attainable standard of health for persons with disabilities. However, it is regrettable that we could not reach consensus on the substantive resolution we deliberated for several months, including with civil society. A resolution whose objectives were for all of us to emphasize the importance of promoting the health and well-being of persons with disabilities, advance universal health coverage, ensure the protections of persons with disabilities during public health emergencies, train health personnel, and ensure that persons with disabilities are part of the decision process. The active participation of persons with disabilities in the deliberations and their input were vital for the resolution as well as for the framework. We want to end our statement by thanking the dedicated team of the WHO Secretariat working on disabilities and rehabilitation under the leadership of Dr. Natasha Azzopardi Muscat and the technical team Satish, Katal, Tom, Kerry, and all others who were involved in the process of developing this framework, whose dedication, commitment, and professionalism were extremely evident throughout the process. To conclude, we would like to ensure persons with disabilities in our country, in the region, that Israel will continue to support your work and push this agenda forward in order to achieve the highest attainable standards of health for persons with disabilities. Thank you, Chair.
Merci, Israel.
Thank you, Israel. I'd like to take this opportunity to personally thank you for the consultative role in the informal consultation that Dr. Rui Portugal took. Would any of the member states like to take the floor on this point? I see none, so I declare this point definitely closed and come back to the regional action plans for ending AIDS and the epidemics of viral hepatitis and sexually transmitted infections and tuberculosis. We have a whole number of documents which serve as the basis for this discussion. You will have the relevant documents on the screen. In this session, we will be combining two agenda items, 7 and 8, to look at the clear links between these two issues so that we can have the most efficient dialogue as possible. I will now turn to the Secretariat, who will provide us with some remarks on this issue. And you will start with a short video on our Uzbek colleagues.
Menda gepatit bilganimdan keyin tushkunlikka tushdim biroz va Alloh sinovi deb qabul qildim va tushkunlikdan chiqishga harakat qildim. Menda bu kasallik bo'lgan paytida charchash, uyquchanlik, ich qotish, qichish bo'lganini bilganimdan keyin oilaviy poliklinikaga chiqdim va oilaviy poliklinika menda sarg'ib borligi alomatini aytishdi. Poliklinikamga borganimda ular virusologiya ilmiy tekshirish institutiga yuborishdi. Virusologiya ilmiy tekshirish menda gepatit C borligini aniqlashdi. Shifokorlar menga mehribonchilik qilishdi. Bu kasallikda davo borligini aytishdi va dorilar chiqqanini. Shifokorlar menga aytishga dori berishdi 3 oylik. Uni telefonimga signal qo'yib 3 oy davomida qabul qildim va yana qaytadan tekshiruvga borganimda virus o'lganini aytishdi. Ancha xursand bo'lib qaytib keldim. Kasallik bo'lganimdan keyin oila a'zolarim meni qo'llab-quvvatlashdi. Turmush o'rtog'im buni ishonmadilar. Tekshirdik. Tekshirganimizda gepatit aniqlangandan keyin ular ham meni qo'llab-quvvatlab tushkunlikda chiqishimda yordam berdilar va o'sha kasallikdan keyin ancha munosabatlarimiz yaxshilandi. Men bir shifokorda gepatit C bilan kasallangan bir ayol bilan gaplashib qolganimda u ayol aytdilarki, bir kichkinaroq uyi puli ketadi bu davolashga. Ularga seryoz bo'lgan ekanlar. O'sha ketadi deganlarida lekin menda ham shu bir o'ylanib puli ketsa kerak, mashinani puli ketsa kerak deb o'yladim. Lekin doktorlar yo'q, bu bizda dorilar bor, hammasi o'zimiz beramiz. Pulsiz o'zimizda davlat tomonidan berilgan deyishganda men ancha xursand bo'ldim.
Bugungi kunda mana vatanimizda O'zbekistonda mana shu hammamizga ma'lum bo'lgan surunkali virusli gepatitlar B, C turlarini aniqlash davlatimiz tomonidan bepul yo'lga qo'yilgan. Mana shu jarayon kasalliklarni aniqlanayotganlarning sonining oshishiga, davolanayotganlarning sonining oshishiga olib keldi. Shunga qaramasdan ayrim insonlarda shunday tortinish, ya'ni kasalligini oshkor qilib bo'lishidan qo'rqish xususiyatlari ko'p uchraydi. Lekin bu aksincha o'z vaqtida davolanish kasallikni oldini olishga va kelajakda yaxshi hayot kechirishiga zamin yaratadi.
Gepatit bilan kasallangan odamlarga nima demoqchiman? Aytmoqchimanki, bu Alloh sinovi. Tekshirtiringlar, agar gepatit C kasalligi aniqlangandan keyin uni davosi bor va to'g'ri charchoqlar bo'ladi, holdan toyish bo'ladi, lekin men dorilarni ichganimda nojo'ya ta'siri bo'lmadi. Mana foydasi bo'ldi, alhamdulillah. Hozir o'sha gepatit viruslarim yo'q chiqdi, o'lgan chiqdi, viruslarim yo'q chiqdi. Davolanganimdan keyin bir necha oy o'tdi, homilador bo'ldim va hozirda sog'lom farzandim bor, alhamdulillah.
Thank you very much. I have the honor of now giving the floor to Dr. Nino Bazzuli, the Director for fighting transmissible diseases, communicable diseases. So we also have Tajikistan and North Macedonia colleagues from there joining us, and they will also be introduced in a moment.
Thank you so much, Chair. Distinguished ministers, honorable delegates, dear colleagues and friends, it is my pleasure to welcome you to this very important session. And it was wonderful to see this short video to see how collectively we can make a difference in lives of the people, through the patient experience. Please allow me to introduce the regional action plans for ending AIDS, epidemics of TB, viral hepatitis, and the sexual transmitted infections. But I will start with the few quick facts where we are in the WHO European region for these diseases. For TB, we are well positioned to end TB. WHO European region has the fastest decline in the incidence of TB and the mortality in the world. However, the drug resistance tuberculosis is the biggest challenge and the main concern in our region. Drug-resistant TB success rate still is less than 60%. For HIV, we are not on track to control HIV. The European region, the WHO European region, and especially the eastern part of our region, has the fastest growing HIV epidemic in the world. And we have a blunt proof. The annual number of new infections has increased in the region in the past decades, and the social exclusion and restrictive legal environments for key populations are leaving them behind. TB, HIV co-infection rate is high, and the treatment outcomes are poor. We are on promising path towards eliminating hepatitis and can accelerate the response. 33 member states in our region out of 50 have successfully implemented the childhood hepatitis B vaccination programs, demonstrating the commitment for strategic planning towards hepatitis elimination. However, the number of annual treatment initiations for hepatitis C increased only by 20% in the region, and the pace is too slow on the path towards the hepatitis C elimination. STIs, sexual transmitting diseases, are challenging us in a new way, and sexual health is a topic of the political negotiations. But we have good news, and the future definitely needs promising. What needs to be done in order to reverse the epidemic of this disease in the region? The action plan to end AIDS and the epidemics of viral hepatitis, STIs, and TB, action plan for the European region 2023-2030 outlined the strategies and priority actions, and I will focus only on a few. First is have people at the center of our response, and this means that services need to be closer to the people in a way that works for them. Second, this is the equity-driven response, engaging through all service delivery platforms and the structural barriers to improve and address the social and the structural barriers to improve the access of vulnerable and the most at-risk communities. Without this, we will not get there where we aim. Rapid uptake of successful innovations and research together with use of new technologies, rolling out new testing strategies, treating all with best medicines, and using the digital health throughout the care pathways. And finally, accelerate the current pace for early diagnosis and scale-up treatment with simplified, decentralized, and integrated service models. The regional action plans narrate in detail these strategies and is a result of a year-long consultative process with all of you and with the civil society. Yesterday we had the ministerial lunch, which demonstrated strong commitment and enthusiasm from the member states and the partners and the non-state actors to end the epidemic of these diseases. If we have the political will to achieve the ambitious targets in the regional action plans, of course we succeed. We need more resources and efforts that are available now, not less. And we have suitable and very well-functioning platforms to partner with affected people and the communities to end the epidemic of this disease. And I'm joined here today with Safar and Andrei, who will bring their perspectives, how we can partnership with the communities to end the epidemic of these diseases. And I'm happy to introduce Andrei Stanic from North Macedonia, who is an activist and represents communities living with HIV. Please, for short intervention.
Dear ministers, dear representatives of member states, I'm addressing you as a person living with HIV and a community activist from Southeast Europe. I'm very happy that we are finally talking about the prospect of eliminating the epidemics of sexually transmitted infections, in addition to HIV and viral hepatitis, and that countries are ready to commit to it. We are not condemned to live with these infections forever. We already have an array of proven approaches to treat and prevent them. Elimination has finally become a feasible political goal, but it can be achieved only if we focus on the needs of real people without prejudice, committing to destigmatize sexual health, and provide a combination of evidence-based services at the level of communities. I expect that civil society and community models of service delivery will become a major component of the national responses and will receive adequate funding to fully utilize their capacities. It is within your reach as the decision makers of today to bring about the end of HIV, viral hepatitis, and STIs. What an inspiring opportunity. Please make use of it. Thank you.
Thank you so much, Andrei, for this inspiration and the call to action. And I would like now to introduce Safar Al-Naimov, who successfully fought multi-drug resistant tuberculosis and who is from Tajikistan. Thank you.
Thank you. Good day to all. Years, and I'm from a small village south of Tajikistan, Farhor town, and I have two decade-long stories with TB. 1 decade, the first 10 years of struggle, family struggle with multi-drug resistant TB, finally ended with losing 2 brothers of mine and surviving myself from this nightmare. And the second 10 years was and is the struggle with TB as Stop TB Partnership Tajikistan, which is a coalition of TB-affected communities and anyone who cares about TB. So in this 1 minute or 2, what I want to say is that we have amazing events, we have amazing people, we have amazing documents. But what I want to say is that we have all to have faith on each line, on each pillars, on each words of what we have agreed, we have adopted, and we have signed. So this faith of ours will decide our actions. This quality of our faith would decide how we act and how fast, how soon as we end the stories like mine and my friends. And at country levels, we have a number of sensitive issues that actually can be resolved through the high-level participation of leadership in the countries. So we have in our countries great leaders that we are proud of, and we count on our leaders to rescue us just by their attention. And usually TB affects and unites people, patients, and doctors. I understand my doctor understands my issue. We understand each other, but in most cases, others don't understand us as a unit. So with this, I would like to end my long story with TB just by saying that today in this important milestone, looking into the next milestone, which for me is the United Nations high-level meeting on tuberculosis in New York. So we would like to have attendance, direct attendance of our head of nations. Last time in September 26, 2018, it was a great event, very promising, but disappointing as well for us as communities, since none of the head of states from our region attended the event. But this time, we wish they will attend. And this is just not a wish, this is a request, a deep request, sincere expectation and hope. And we really count on you, delegates and the country, ministers, to help us on this. And remember, behind us, behind me, these statements, there are millions of people with silent voice. They're silent. There is a great hope and expectation. Thank you very much.
Merci beaucoup.
Thank you.
Je me tourne à...
I would now turn to Dr. Ren Mingui, the Assistant Director General for Universal Health Coverage in Geneva, who will say a few words about the work on the global level.
Je suis informée.
I am being told that he will not be contributing, which is unfortunate but helps with our time management. So I will now open the discussion at this point and turn to member states, starting with Czechia, who will be speaking on behalf of the European Union and its member states. You have the floor.
Honorable Chair, Regional Director, Excellencies, colleagues, I speak on behalf of the European Union and its member states. Major health disruptions in the Euro region, such as the pandemic and the escalating humanitarian crisis caused by Russia's unjustified and unprovoked war of aggression against Ukraine, remind us how fighting against infectious diseases like HIV, VIH, and STIs requires strengthened health systems adapted to achieve UHC. Unfortunately, we were unable to invert the major public health burden of these diseases in the region, which continue to impair quality of life and cause premature mortality with new infections on the rise. The EU and its member states welcome the new regional action plans, noting the participating and inclusive process and their alignment with other important documents and action plans, as well as commending the ambitious vision and goals embedded. The time to act is now. Acknowledging the similarities and differences between these diseases is paramount to establishing a combination of disease-specific approaches for integration and transversality across the health systems. The focus on key populations is crucial. Therefore, we must tackle all access barriers for persons in vulnerable situations and high-risk and key populations, including by removing criminalizing laws, reforming restrictive legal and policy frameworks, and removing stigmatization and other human rights and gender-related barriers. As per the new European Consensus on Development, the EU remains committed to the promotion, protection and fulfillment of all human rights and the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development and the outcomes of the review conferences, and remains committed to sexual and reproductive health and rights. In this context, having that in mind, the EU reaffirms its commitment to the promotion, protection and fulfillment of the right of every individual to have full control over and decide freely and responsibly on matters related to their sexuality and sexual and reproductive health, free from discrimination, coercion and violence. The EU further stresses the need for universal access to quality and affordable comprehensive sexual and reproductive health information, education, including comprehensive sexuality education and healthcare services. We are concerned that these aspects are very limitedly referred to in the new regional action plans, as they are essential in ending HIV, VIH and STIs. We must push forward the shift towards comprehensive evidence-based interventions and person-centered primary health care that promotes not only physical but also mental and social well-being. We look forward to continuing working together with civil society representatives, communities and global partnerships. Such interaction is paramount to reducing stigma and improving access to health services, particularly for these diseases. We also urge all actors to address the immediate health challenges in Ukraine and neighboring countries, namely continuity of HIV treatment and necessary healthcare services, leaving no one behind, especially the most vulnerable. Tolerance, respect, and human rights, including the right to health, must be upheld even in the most severe crisis. Lastly, to this topic, we urge all member states in the region to accelerate the pace and scale of prevention, testing, and treatment services for HIV, VH, and STIs. We welcome the adoption of the Tuberculosis Action Plan for the WHO European Region 2023 to 2030, especially with a view to the fact that tuberculosis continues to pose a life and endangering public health threat in the WHO European region, disadvantaging vulnerable populations. We are concerned by the increasing global trend in mortality. The antimicrobial resistance must be addressed in a consistent manner. Worryingly, we also know that the incidence of these diseases is rising while there are persistent gaps and uneven progress towards the targets set during the high-level meeting on the fight against TB. We highly acknowledge that some member states, communities, and vulnerable groups need specific evidence-based strategies and support in order to accelerate progress in preventing disease and death, as well as the necessity of the equitable access expansion to interventions.
I would invite you to please conclude, sir.
Thank you.
Merci.
Thank you very much. Now, let us move to Norway, followed by the Russian Federation, and then Turkey. Norway, please.
Thank you, Chair, Regional Director, Excellencies. I make this statement on behalf of the 8 Nordic and Baltic countries, namely Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Sweden, and Norway. We fully align with the statement made on behalf of the European Union and its member states. We thank the Secretariat for drafting the Tuberculosis Action Plan for the WHO European Region 2023 to 2030 and the related resolution. The Nordic and Baltic countries welcome the continued work on eliminating TB in the region. I will now focus on item 7, the Regional Action Plan for Ending AIDS, and the epidemics of viral hepatitis and sexual transmitted infections. The Nordic and Baltic countries welcome the regional action plan on these important matters that continue to pose a major public health burden affecting millions of people in the region. We especially welcome the first dedicated action plan in the region focusing on STIs. To reach the goal of ending AIDS and the epidemics of viral hepatitis and STIs, strong health systems and universal health coverage are essential. Of equal importance is ensuring evidence-based approaches with a strong focus on human rights and fighting stigma and discrimination. We appreciate the recognition of targeting and responding to key populations who are often at risk of being marginalized. This focus is essential in reaching the goals of the action plan. It is crucial to ensure that LGBT+ people, sex workers, migrants, and people who inject drugs have access to high-quality healthcare services without stigma or discrimination. We echo the concern raised by the EU and its member states, and we further stress the need for universal access to high-quality and affordable, comprehensive sexual and reproductive health and rights, including comprehensive sexual education and health services. Educating young people and key population is an effective preventing measure for HIV, STIs, and hepatitis. In order to effectively address the challenges relating to HIV, hepatitis, and STIs in our region, 2 approaches should have been explicitly highlighted in the action plan and the resolution. First, a continued increase in harm reduction interventions, particularly needle exchange program and medically assisted therapy, and secondly, introduced an increased rollout of pre-exposure prophylaxis. Research shows that providing a comprehensive package of such services reduces the spread of HIV and is in line with WHO guidelines. We urge all member states to adopt the action plan and strongly advocate for strengthening of health systems without stigmatization and discrimination through human rights and SRHR-based approach. Lastly, we would like to thank the Regional Director for the initiative for the ministerial lunch on resetting the course towards ending tuberculosis and AIDS, and eliminating the epidemics of hepatitis and STIs. We are looking forward to continue to work on eliminating these diseases in the region. Thank you.
Merci.
Thank you very much, Norway. I shall now give the floor to the Russian Federation, to be followed by Turkey, and then Switzerland. The Russian Federation, please, you have the floor. Thank you very much, Madam. On agenda item 7, the issue of eradicating HIV/AIDS and viral hepatitis and STIs as health issues are more topical than ever, of course, as the COVID-19 pandemic has demonstrated the importance of constant coverage and broad testing, as well as on-time starting of ART and looking at communicable diseases. These are important to stopping the spread of HIV/AIDS, viral hepatitis, and STIs. The support of these measures, both on a regional and a universal level, are important to ensure constant monitoring of the situations in all countries. Since 2017, the Russian Federation has had a federal register of HIV/AIDS infected people, which has information on all of the cases of HIV/AIDS infection in the country. Currently, we are also considering the issue of registering people who have viral hepatitis and coming up with ways to fight hepatitis C. As an effective preventive HIV/AIDS and viral hepatitis and STI measure, we think that raising awareness amongst young people is key. We need to underscore responsibility in sexual relations, as well as, of course, the Institute of the Family and Marriage. The Russian Federation thanks the WHO for coming up with a regional plan of action for ending AIDS and the epidemics of viral hepatitis and STIs for 2022-2030. And we know that the high level of organization of and wonderful content of the document as part of the multilateral consultations. However, we cannot support in the plan of action things such as sexual orientation or gender, because we believe that the document is politicized and also mentions terminology such as the war in Ukraine, which we don't support. Also, in the text of the resolution, there are non-aligned terminologies used, and they're not based on data. Sexuality, sexual reproductive health, and other bases for data. And the plan of action and the resolution, if they are still to contain these terminology, have to be put to the vote, and we're going to vote against them. With regard to other issues, we believe that over the last few years, we've seen a reduction in mortality from tuberculosis. For example, over the last 20 years, the mortality from tuberculosis in the Russian Federation has fell 3 times and mortality 5 times. In 2024, or in previous years, we've worked to reduce the burden of tuberculosis. And we have a number of tuberculosis-focused events in the Russian Federation, and we hope to preserve the positive trend that we've seen in decreasing mortality. We need to redouble our efforts, however, to ensure prevention of tuberculosis for risk groups using ICTs and increasing the quality of diagnosis and care, which is given to people with tuberculosis and other tuberculosis-related infections. We believe that the leading role of the WHO in this work will be preserved with joint efforts, and that's the way that we can reach our common goal to reduce mortality from tuberculosis in a short period of time. We thank the WHO for its inclusive approach to coming up with a plan of action and its attempts to reach consensus. But again, we must note once again the fact that there are a number of terms in the documents which we cannot support. For example, war in Ukraine. And if that is to remain, then we have to put these documents to the vote, and we'll vote against them. I thank you very much for your kind attention.
Merci. La Fédération.
I thank kindly the Russian Federation. I shall now give the floor to Turkey, to be followed by Switzerland and then Germany. Turkey, please, you have the floor.
Thank you, Madam Chair. Regarding the late delivery of revised documents, we had not enough time to discuss the amendments and intended outcomes behind it. Turkey claims to be dissociated from this particular resolution. We are very well aware and appreciate Secretariat's hard work while carving and preparing this document. However, we hope more inclusive discussions in the future and more respect in different countries' country-specific circumstances. Turkey will be committed to its national plans to reach the ultimate goals for ending AIDS and epidemics of viral hepatitis and sexually transmitted infections. Thank you, Madam Chair.
Merci la Turquie. Je passe à présent
I thank Turkey, now Switzerland, to be followed by Germany and then Georgia. Switzerland, please, you have the floor.
Mesdames et Messieurs, les membres
Ladies and gentlemen, delegation members, Switzerland thanks the Secretariat for its considerable work done on the plan of action, regional plan of action for ending AIDS and epidemics of viral hepatitis and STIs 2022-2030. This work is essential to allow us to move forward on the issue of sexual health in the European region. At the same time, when COVID-19, of course, has slowed progress in a number of areas and has put onto the back burner a number of HIV/AIDS programs, viral hepatitis, and STI programs. The regional plan of action will allow us to come up with a new national plan of action which will reduce HIV/AIDS infections and viral hepatitis infections and reduce STIs in general, and this will enter into force in 2024. We would like to recall two key parts of the global approach and what we need to do to move forward in this program. First of all, the importance of integrating sexual health programs in primary health care programs, for example, managing STIs as part of that. This step will help us to have better health coverage of difficult-to-reach populations and vulnerable, marginalized populations such as drug users, injecting drug users. Second of all, the importance of proposing to young people sexual education and care, which would stop the spread of HIV/AIDS and other STIs, reducing risk and increasing different types of contraception. Thank you very much for your kind attention. Thank you, Switzerland. I shall now give the floor to Germany, to be followed by Georgia and Slovakia. Thank you.
Danke, Frau Vorsitzende.
Thank you, Chair. Germany aligns itself with the statement made by the EU. Germany would like to thank the WHO Euro for the development of the action plans for ending the epidemics of AIDS and the epidemics of viral hepatitis and sexually transmitted infections. And I would also very clearly like to thank you for the ministerial lunch yesterday. It was really excellent, and I think there's also a spirit of constructively moving forward. It was very impressive. The goals that are listed in the action plans are highly ambitious, but in our view they are achievable, but only if we get more wind in our sails and if we manage to overcome the deficits that currently exist, particularly exist in our region. It's very unfortunate that we, in comparison with other regions, are falling behind other regions and may miss the boat here. There are 3 points I'd like to highlight that seem necessary from our point of view to achieve these ambitious goals. Firstly, in the face of any discrimination, stigma, this needs to be reduced. This is also very clear in the statements made by our guests. Secondly, access to health services for key groups, including LGBTQI communities, needs to be ensured. And thirdly, the general access to high quality and full information on sexual health and rights. This includes full sexual health education. Germany is in favor of adopting the action plans, and we very much hope that member states of the WHO Euro region will face these challenges together to achieve these goals. Thank you very much.
Merci l'Allemagne. Je passe à...
Thank you, Germany. I shall now give the floor to Georgia, to be followed by Slovakia and then Austria. Georgia, please.
Thank you very much. Dear President, distinguished delegates, Georgia highly appreciates work undertaken by the World Health Organization Regional Office for developing the regional action plan for ending AIDS and the epidemics of viral hepatitis and sexually transmitted infections by 2030. We will acknowledge that the fight against these diseases requires joint efforts and coherent actions across sectors and across borders. To date, global support for national and regional initiatives aimed at HIV, hepatitis, and STI control has been strong. These initiatives are directed towards creation of sustainable political support, strengthening health systems, empowering patients, communities, and civil society, conducting scientific research and gaining from the technological advances. The Regional Action Plan for Ending AIDS, the epidemics of viral hepatitis, sexual transmitted infections, will help us to match national regional efforts and renew our joint rapid progress to end these public health threats by the end of 2030. Based on the country's successful experience and progress made on the road of elimination of hepatitis C and ending AIDS epidemic, we fully support the regional call of the World Health Organization for a shared responses to HIV, viral hepatitis, STIs within the UHC and health systems approach. Our experience proves that with universal access to drugs and high-quality services, strong political commitment, international collaboration, and civil society engagement, it's quite realistic to achieve elimination targets. Considering the limited fiscal space, especially during the COVID-19 pandemic, we highly support the World Health Organization's regional vision and support of sustainable and predictable financing, optimization of service delivery models, and providing rapid access to innovations in HIV, viral hepatitis, STI commodities through comprehensive price reduction strategies for medicines, technologies, and novel products. We believe the translation of the Regional Action Plan into the national strategies will offer many opportunities for achieving the milestones and targets for ending all these diseases. Within the UHC coverage framework, focused efforts are required to widen access to prevention, detection, and linkage to care for all people living with HIV and other high-risk groups. Ongoing efforts aimed at strengthening primary healthcare services and greater integration of disease-specific programs will further improve access to a full spectrum of services. Developing regulatory and institutional framework for civil society engagement in service delivery in a structured, sustainable manner is essential to make the service provision models more people-centered and improve coverage of key populations. In conclusion, we fully support the endorsement and implementation of the Regional Plan of Action and remain committed to regional and global efforts towards elimination targets. I thank you, Chair.
Thank you, Georgia. I shall now give the floor to Slovakia, to be followed by Austria and then Spain. Slovakia, please.
Thank you, Madam Chair, Regional Director, Excellencies and colleagues. Slovakia aligns itself with the statement of Czech Republic made on behalf of EU and its member states on this agenda item. Slovakia would like to thank the Secretariat for elaborating regional action plan on this agenda item. And in the last 2 years, Slovakia has adopted and implemented the standard procedures for comprehensive management of HIV infection and preventive guidelines for pre-exposure prophylaxis in the population at increased risk. In terms of accessibility, the HIV testing and post-exposure prophylaxis is available to every individual across the country. The ART, viral hepatitis, other STIs, and TB treatment is provided for all the populations, including affected communities by humanitarian crisis in the region. These days, we are submitting to the government a new national HIV and AIDS and other STIs preventive program based on conclusions of WHA. We are convinced that it is necessary to create more favorable conditions for multidisciplinary and interdisciplinary, but also multisectoral activities and campaigns aimed at decreasing the stigmatization of people living with HIV and AIDS, while it remains essential to continue in effective prevention on this threat. The actual and active surveillance and timely introduction of prevention, treatment, and comprehensive care for persons living with HIV is crucial. Considering the new generation of its important investment also into the education and health literacy. The most important is to support systemic knowledge translation about research finding that undetectable equals untransmittable. We support national and regional effort to ending stigma in society and among healthcare workers and highly call for the new evidence-informed community and behavior-driven initiatives empowering people living with HIV, hepatitis, and TB or being affected with to collaborate on this significant change in the region. Let me conclude by saying that Slovakia fully supports further engagement in international evidence-based activities aimed at ending the HIV and TB epidemics, and we hope in adoption of this action plan. Thank you.
Merci, la Slovaquie.
Thank you, Slovakia. Now Austria, to be followed by Spain and then the UK. Austria, please.
Thank you, Chair. Austria aligns itself with the statement made by the EU member states, which was presented by Czechia. We would like to thank the regional office for the action plans for ending AIDS, viral hepatitis, and STIs. Austria welcomes the integrative approach of the action plans, which allows a patient-oriented access and the use of synergetic effects. Furthermore, we believe that continuing to develop the offers of treatment and easy access for achieving these next goals is very important. Taking into account co-infections, many screening options, and in particular cooperation with various treatment centers for those affected needs to be highlighted. In our view, there is a need for the support of key populations as well as preventing stigmatization of those affected. In the light of preventing infectious diseases, sexual education needs to be emphasized, as well as further promoting health awareness in the general population. The 3 pillars of the new action plan on tuberculosis, with their corresponding focuses, are key in order to ensure that we can continue to fight TB on a global level and face the regional challenges. Effectively monitoring and the early detection of cases, as well as a quick and full treatment of those affected, is absolutely necessary in order to ensure that we can fight these serious but preventable diseases in Europe. In the entire region, we are improving diagnosis, treatment, and further support of patients, including digital health solutions. For Austria, it is essential that no one is left behind and that particularly vulnerable groups can be reached. We need easy access to healthcare as well as promotion of general health awareness. On the basis of national health, we would like to draw attention to the difficulties in providing enough medical supplies, and we welcome the support of WHO and partner organizations. Thank you very much.
Thank you, Austria. Spain next, to be followed by UK, and then the Netherlands. Spain, please.
Thank you, Chair. Director General, estimated delegates, Spain aligns with Czech Republic on behalf of the European Union and its member state statement. My country supports the Regional Action Plan of Ending AIDS and the Epidemic of Viral Hepatitis and Sexually Transmitted Infection 2022-2030. Spain, in line with what was expressed by the European Union, support the adoption of integrated regional action plans against HIV, viral hepatitis, and STIs, since the integration of 3 infections contributes to the response strengthening. Spain, like the EU and its member states, appreciate the long but inclusive process in which both of the global health sector strategies on AIDS, EU, viral hepatitis, and STIs 2022-2030 were approved in the World Health Assembly last May, as well as the regional consultation regarding the region plans have taken place. We would like to underline the importance of not renouncing to the language reached on sexual and reproductive rights so far on the EU International Conference, as well as maximizing the decision-making based on the scientific evidence. In any case, the regional plans can and must be adapted to local context, both of the epidemiological levels and at the social and cultural level. Spain welcomes the vision of addressing stigma and discrimination as essential aspects of the strategies and recognizes the relevance to involve
all population, in particular the most vulnerable, so that we leave on no one behind. We have learned during these decades that health response and those of healthy system must be sensitive to people's needs. Spain wishes to share the work of the Social Pact of Non-Discrimination for Equal Treatment associated with HIV, a historical claim of Spanish civil society endorsed in November 2018 by the Ministry of Health. This pact recognized the need to provide consistent and stable multi-sectoral response to address structural discrimination, involving all actors and establishing alliances to address other forms of discrimination, whether based on age, gender, sexual orientation, socioeconomic position, place of birth, and race of ethnicity. This pact is a pillar of Spanish strategy to eliminate this infection as a public health problem by the year 2030. And we announced that Spain wishes to lead an initiative whose objective is to seek political commitment around the elimination of stigma and discrimination due to HIV in Europe by 2030, framed in the Spanish presidency of the European Union in 2023. Thank you very much.
Merci.
Thank you very much, Spain. UK, followed by Netherlands, and then Ukraine. UK, please.
Thank you, Chair. The UK is grateful to WHO Euro for their work on developing the draft regional action plans for ending AIDS and the epidemics of viral hepatitis and STIs up until 2030, including through the consultations that you've held with member states. We fully support the role WHO plays in developing evidence-based health strategies for improved health outcomes. Effective approaches must promote equity, gender equality, and protect and fulfill the human rights and dignity of all. We note the regional action plans are available for countries to take forward based on their national context while upholding fundamental human rights. I was particularly pleased to have the opportunity to share the UK's experience on tackling HIV and AIDS at the ministerial lunch yesterday. I won't repeat what I covered there, but I'm very happy to share more detail with anyone who's interested. We strongly support the Regional Committee adopting these regional action plans as they are drafted. We had hoped that this could be agreed by consensus. The content of the draft action plans is, as I've said, evidence-based and in line with the global health sector strategies. And this is also true of the inclusion of the situation in Ukraine, and we fully support including that position in the strategies. Again, based on the evidence and the importance of tackling the epidemics there for meeting our regional targets. So finally, we stand ready to work with WHO and with member states to continue to tackle the diseases across our region, to support all of those who've been affected, and to end these epidemics quickly and effectively, ideally ahead of target. Thank you.
Merci.
Thank you, UK. I now give the floor to Ukraine, to be followed by Israel and Kazakhstan. Ukraine, you have the floor.
Sorry, Chair, we must be online.
Thank you, Chair. Ukraine has chosen the path of integration with the European community, making combating socially significant diseases one of its key health care priorities. My country has achieved significant success in combating these diseases based on a human-oriented approach, which takes into account European values. We managed to implement important health sector reforms with the widespread use of outpatient treatment of tuberculosis and digital solutions to update the standards of care in accordance with the modern WHO guidelines to implement the innovative approaches. With the WHO support, Ukraine is one of the leaders in implementing modern, innovative, short-term treatment regimens, new drugs. The risks of tuberculosis and HIV are increasing amid the ongoing war of aggression, which provoked unprecedented health and displacement crisis not seen in Europe since World War II. Saving the life and health of our citizens is the most important task of healthcare system. From the first day of the war, we have been taking urgent measures to adapt to the new realities, so that each of our patients continue the treatment of these diseases. However, patients in the temporarily occupied territories are still at significant risk of treatment interruption. In contravention of international humanitarian law, the aggressor state has already damaged more than 800 healthcare facilities, completely destroying more than 100 of them, including the regional anti-tuberculosis facilities. Ukraine already has a government state strategy on combating HIV, tuberculosis, and viral hepatitis until 2030, which is fully aligned with the WHO strategy. Understanding the critical importance of a strategic vision for the further recovery and development of anti-tuberculosis care for the population and HIV-affected people, the Ministry of Health of Ukraine is committed to developing a national plan to combat TB and HIV based on the new WHO regional plan. At the same time, we rely on the comprehensive support of the European Regional Office in this work and further involvement of international partners, donors, and the public. We appreciate the valuable contribution of our international partners provided to Ukraine's. Working together, we will be able to rebuild a European-style healthcare system in which human life has the highest value and combating socially significant diseases is duly integrated into the healthcare system. I thank you.
Merci, l'Ukraine.
Thank you, Ukraine. I now give the floor to Israel, to be followed by Kazakhstan. Israel, you have the floor.
On behalf of the Israeli Ministry of Health, I would like to congratulate our colleagues at the WHO Euro, Dr. Hans Kluge and Dr. Askar Yadilbayev, and their teams in particular, for their tireless work in compiling the Regional Tuberculosis Action Plan. The Regional Action Plan, which integrates the End TB strategy into a European area context, includes several programmatic elements that Israel has incorporated into its TB core model. Israel is in the TB pre-elimination phase, a testament to the potential such planning can have not only in our small country, but for the entire region. As the Regional Action Plan delineates, a solution to our challenges may lie in digital health. Implementing such a process requires bringing all stakeholders, from health practitioners to tech experts to policymakers, together. Israel's ability over the last 25 years to approach elimination is due partly to its multifaceted approach to TB screening, diagnosis, and care, especially for migrant population. It is this success that has led to Israel's recent designation as a WHO collaborating center for research and training on tuberculosis elimination. We look forward to sharing our experience in specialization with other countries. Together, we can make TB elimination an attainable goal. As for HIV, the State of Israel Ministry of Health welcomes the publication of the regional action plans for ending AIDS and the epidemic of viral hepatitis and sexually transmitted infections 2020-2030. The strategic direction of ending AIDS can be categorized into three key areas: accessibility to testing and treatment, comprehensive care for HIV and its comorbidities, including TB, and continued innovation in preventing and treating HIV. These three key areas are a guiding focus of the Ministry of Health strategy for HIV in the 21st century. As the low endemic country for HIV, Israel's success is due in part due to screening for immigrants from high HIV endemic countries, a treatment program for immigrants without medical insurance, tailored test and treat campaigns for various risk groups, and diagnostic and pharmaceutical intervention, including the recent inclusion of PrEP HIV in the standard basket of care available through universal health care to all Israelis. The Israeli MOH strongly supports the WHO Regional Action Plan for Ending Viral Hepatitis and follows it closely, namely the scaling up of screening, testing for targeted risk population, and the facilitation of free treatment for all HCV patients, regardless of type or severity. Aligned with WHO strategy, the MOH has launched a national program and continues robust monitoring. Israel shares the observation that for most effective treatment, any approach to combating STIs must be led by data, prioritize key population, involve multiple stakeholders, and utilize an innovative combination of prevention approaches. Thank you.
Merci Israël.
Thank you, Israel. I now give the floor to Kazakhstan.
Добрый день, уважаемые коллеги. Правительство Казахстана, пользуясь случаем, выражает свою признательность Европейскому бюро ВОЗ за разработку такого комплексного всеобъемлющего плана по борьбе с этими заболеваниями. Вчера на министерском обеде мы об этом говорили долго и подробно. Не хочу повторяться теми цифрами. Сегодня те успехи, которые достигнуты в Казахстане по борьбе с туберкулезом, нам вселяет уверенность, что цели 2030 по борьбе с туберкулезом, по ликвидации эпидемии туберкулеза
These epidemics are achievable. In the last 10 years in Kazakhstan, morbidity dropped by 2 or 3 times and mortality by 6. So today we are ensuring universal access to treatment. All patients from all countries are provided with schemes which reach them in about 95% to treat them for tuberculosis. This is on the basis of patient-oriented approaches of treatment of patients based on their needs, ambulatory treatment using digital technology, and of course those innovations which exist in the world and which have a useful basis are being used by the government of Kazakhstan. To conclude, I would like to say that Kazakhstan supports this plan, and we consider that it can be a strategic document for many national programs. Thank you.
Je n'ai plus d'États membres qui souhaitent prendre la parole selon mes informations. Est-ce que c'est bien le cas? Est-ce que quelqu'un souhaiterait encore s'exprimer? Je n'en vois pas. J'ai pris bonne note de la demande de la Fédération de Russie de procéder à un vote. Je vous propose néanmoins de conclure d'abord la discussion et me tourne en ce sens vers les partenaires internationaux et donne tout d'abord la parole au partenariat pour stopper la tuberculose.
TB Partnership.
Thank you, Madam Chair, for time for this statement on behalf of the Stop TB Partnership. Distinguished delegates, in many instances, the WHO European region is leading the world to achieving the bold targets set forth by the United Nations High-Level Meeting on Tuberculosis in 2018. We welcome the new regional plan for TB and applaud the great efforts made by countries to substantially reduce TB incidence and mortality. However, still over 600 people per day get sick with tuberculosis in the region, and more than 70 people per day die of it. About 1 in 5 new TB cases and half of retreatment cases are with multi-drug resistant TB. By very far, these are the highest proportions in the world. The region is home for almost half of the global burden of the most extensive resistance to drugs, XDR and pre-XDR TB. In the face of this, we would like to call on all member states in the region to enable the health systems to address TB through a comprehensive package of interventions integrated in the national prepared financing schemes and health system reforms. This package should explicitly cover rapid diagnosis, active case finding, and WHO recommended treatment regimens with appropriate adherence support, as well as TB prevention among contacts and other population groups at risk. and to ensure universal access to quality TB services for all people in need, including the most vulnerable, by engaging and empowering civil society and affected communities. Finally, we have to ask specifically for the countries of Western Europe, where it often looks like there is a feeling that TB is not our problem anymore. TB guidelines need to be updated, access to rapid molecular testing and availability of second-line drugs and preventive treatment must be ensured. And finally, cross-border collaboration on TB needs to be strengthened. Thank you once again for your commitment and support to end tuberculosis in the region and globally.
Merci beaucoup. Je passe à présent aux acteurs non étatiques et donne volontiers la parole à la Fondation pour les soins contre le HIV qui représente 6 acteurs non étatiques. Vous avez la parole.
Honorable Chair, Regional Director, Delegates, this is a joint statement on behalf of AHF Europe and 5 co-signing organizations. The action plan to end AIDS is the third action plan for Europe. We commend integration of HIV, hepatitis C, and STI in the action plan. We hope it's a clear signal for a stronger integration of the three in practice. The plan clearly presents major remaining challenges in the European region. The eastern part of the region lags behind 1990 targets, with respective rates of 70, 75, 94. The challenges to contain the HIV epidemic are driven by insufficient HIV prevention, testing, and treatment services for key populations. Ending AIDS is not possible without addressing the needs of the key population and scaling up services for them. As mentioned by the delegates during the meeting, we need to return and double the efforts in the areas which were forgotten during the COVID pandemic, and HIV is one of them. To address the challenges, strong political commitment on the highest European level is needed. We strongly believe that unless Europe's political leaders acknowledge the inequalities between the western and eastern part of Europe with regard to the number of infections and unanimously recognize the goal of ending HIV epidemic as part of their political agenda, we will continue to report increase of HIV incidence in Europe and will have more deaths related to AIDS and TB, deaths which are preventable. We urge to look into models which are supported by science, models related to people-centered care strategy, user-driven care, including in palliative care, task shifting, using trained personnel and community services. It's been 40 years of HIV now. We urge all the member states to support the resolution to end AIDS in Europe by 2030. Thank you.
Merci beaucoup. Je me tourne à présent vers le secrétariat pour des réponses. J'ai compris que le docteur Ren Mingui était avec nous, donc je me permets de lui donner la parole pour des réactions sur les commentaires qui ont été faits et ces éléments sur la stratégie globale.
Thank you, Madam Chair. Honorable Ministers, colleagues and friends, it's my great pleasure and honor to speak to the virtual platforms on this very important agenda. Let me go straightforwardly to the significant challenges that remains in our work towards ending tuberculosis and AIDS and eliminating the epidemics of viral hepatitis and sexually transmitted infections. In the WHO European region, an estimated 2.6 million people live with HIV. 14 million people are infected with hepatitis B virus, and 13 million are chronically infected with hepatitis C. In 2019, there were 4 million new diagnoses for gonorrhea and syphilis alone. TB and drug-resistant TBs continue to present a major public health threat. The region carries a quarter of the global burden of drug-resistant TB, and even a higher share of the most difficult form of extremely drug-resistant TB. TB, HIV co-infections also remains an issue of concern. Fundings often fall far short of what is needed. Many outbreaks, STIs, hepatitis, and other infections stigmatize the population, driving further inequalities in access to life-saving treatment and care. Progress is being hampered by challenges including COVID-19 pandemic and humanitarian crisis triggered by wars in Ukraine. Monkeypox has added further strains into our systems. Now it's time to commit our goals. For the first time, we have fully integrated global health strategies on HIV, viral hepatitis, and sexually transmitted infections to increase the impact of disease-specific response under universal health coverage framework. The ANS TB strategy and global strategy on TB research and innovation also provides clear guidance towards the elimination of tuberculosis. The corresponding draft regional action plans are well aligned with this project. We believe this strategy's framework provide the actions and guide us towards the innovations required to achieve the Sustainable Development Goals by 2030. We thank the member states for your engagement at the World Health Assembly this year, in particular for your pragmatism and flexibility to ensure that we can collectively move ahead while keeping the focus on human rights and gender equality, while key populations affected community at the center of a people-centered primary healthcare approach. We are looking forward to working with you towards these goals and their entrance milestones, including second UN high-level meeting on TB in 2023. WHO stand ready to support member states to ensure that people affected by TB, HIV, viral hepatitis, STIs, and needs of key populations are addressed through the nationally defined approach in close collaboration and partnership with community and civil society. It is still opportunity and possible to reach our goals and save and transform millions of lives. Thank you very much.
Merci beaucoup, Monsieur le Directeur général adjoint, pour vos interventions. Je sais que le secrétariat a écouté attentivement les différents commentaires et s'attellera évidemment dans ce sens. Je vous propose donc de passer à l'adoption des documents qui nous ont été soumis. Je comprends que la délégation de la Fédération de Russie a demandé un vote sur la décision sur le plan d'action contre la tuberculose dans la région européenne de l'OMS 2023-2030, contenu dans le document Euro RC72 Conf 8, et sur la résolution sur les plans d'action régionaux pour mettre fin au sida et aux épidémies d'hépatite virale et d'infections sexuellement transmissibles 2022-2030, contenu dans le document Euro RC72 Conf 6 Rev 2. Je précise ici qu'en ma capacité de présidente, je vous ai soumis 7 propositions de résolution que nous allons maintenant soumettre au vote.
Which we will now put to the vote.
Également de procéder par vote à main levée.
I also propose that we should have a raised hand vote, as they done in our rules of procedure. And finally, I propose that we begin by voting on the decision on tuberculosis and then on the resolution on HIV. I would like to give the floor to our legal counselor now to explain how we will proceed. But I'll first see whether we have the approval of the delegations to proceed in this manner. This appears to be the case, and I now give the floor to the legal counselor. You have the floor.
Merci Madame la Présidente.
Thank you,
Premièrement, la présidente de séance
the chair of the meeting will begin by inviting delegations who are in the room to raise their nameplates, or for delegations which are not physically present in the room at the end of the meeting can use the raise hand function on the platform. if these delegations would like to vote in favor of the proposal which was made by the chair of the meeting concerning the document on tuberculosis, this resolution,
La présidente de séance
the
invitera
chair of the meeting will
ensuite
then
les délégations
invite
à lever leur
delegations
pancarte
to
ou
raise
à
their
utiliser la
nameplates
fonction
or to
lever la main
use
si
the
elles
raise
souhaitent
hand
voter
function
contre
if they would like to
cette
vote
proposition
against this
qui a
proposal,
été partagée par la
which
présidente
was shared
en ce qui
by
concerne la
the chair
tuberculose.
on
Enfin,
tuberculosis.
la présidente de
Finally,
séance
the
invitera
chair
les
of the session
délégations
will
à lever
invite
leur
delegations to
pancarte ou à
raise their
utiliser
nameplate
la fonction
or to use the
lever la
raise
main
hand function
si elles souhaitent
if
s'abstenir.
they would like to abstain.
Il est important que les
It's
délégations
important that
maintiennent leur
delegations should
pancarte
keep their nameplates
levée
raised
jusqu'à ce que la présidente de
until
séance
the chair of the
indique qu'elles
session
peuvent être
has
baissées.
indicated
Une fois
that they
que
can
tous
be
les États
lowered.
membres souhaitent
Once
voter,
all
qui souhaitent voter
member states who would
l'ont fait, il y
like to
aura une
vote
courte
have done so,
pause avant que
there
la
will be a
présidente
brief
des
pause
séances annonce le
before
résultat.
the chair of the session
Merci,
announces the
Madame la
results.
Présidente.
Thank you, Chair.
Merci. Je demande
Thank
au
you.
secrétariat de
I will now
prendre
ask the
place dans la salle.
Secretariat to
Avant de
take their
procéder au
seats
vote,
in the
je
room.
voudrais rappeler à
Before
toutes les
we move to
délégations
the
que les
vote, I would like to
travaux ne
remind
peuvent pas
all
être
member states
interrompus,
that we cannot interrupt this
excusez-moi,
procedure,
que les travaux ne peuvent être interrompus que
that
pour des motions d'ordre
this can
liées au
only be
déroulement
interrupted
effectif du vote.
if it is on a
En
technical matter
outre,
concerning
toute autre
the
question liée
way
au
the vote is
déroulement du
proceeding.
vote doit être soulevée avant
Any
l'annonce des
such
résultats
questions
de vote.
should be raised before the result is
Je dois
announced.
également inviter les
I must
délégations
also
à rester assises
invite
tout au long
all
du vote.
delegates to remain in their seats throughout the vote.
Y a-t-il des questions
Are there
liées au
any
déroulement du vote?
questions connected to the holding of the vote?
Je n'en vois pas, donc
I
je
see none.
déclare maintenant
So
le
I
vote
now
ouvert.
declare the voting open.
Les délégations souhaitant voter en
Delegates who
faveur
wish to vote
de la
in
décision sur la
favor of the
tuberculose
decision
contenue dans
on
le document
tuberculosis contained in document EUR RC72 Conf 8
sont priés de lever leur pancarte ou
are
d'utiliser la
asked
fonction
to
lever la
raise their
main
nameplates
et
or
de les
use the
maintenir
raise hand
levés
function
jusqu'à ce que je donne le
and
signal
keep
de
them
les abaisser.
raised until I indicate that they can be lowered.
C'est la traduction. Est-ce que la Turquie a une question?
Does Turkey have a question?
Merci. Vous pouvez baisser vos
Thank you.
pancartes.
You can put your nameplates down.
J'invite les délégués à baisser leurs pancartes, s'il vous plaît.
You can put your nameplates down, please.
Merci.
Thank you.
J'invite maintenant les
I now
délégations qui
invite
souhaitent voter
delegations who
contre
wish to vote
la
against
décision sur la
the
tuberculose
decision on
Euro
TB,
RC72
Euro
Conf 8
RC72 Conf 8.
à lever leurs pancartes
Please
en
raise
utilisant
your nameplates
soit leurs pancartes
using
ou la
either your
fonction
nameplates
lever la main
or the raise
et
hand
à les
function
maintenir
on
levés
Zoom,
jusqu'à ce que je donne
and
le
keep them
signal de les
raised
baisser.
until I give you the signal to put them down.
Merci. Vous
Thank you.
pouvez baisser vos pancartes.
You can lower your nameplates.
J'invite maintenant
I
les
now
délégations
invite
qui souhaitent
delegations
s'abstenir
who wish to abstain
à lever leurs pancartes,
to raise their
à utiliser
nameplates,
la fonction
to
lever la
use
main
the raise hand
et à les
function on
maintenir
Zoom,
levés jusqu'à ce que je
and
leur
to
signale de
maintain
les
these
baisser.
upheld until I tell you you can put them down.
Merci.
Thank you. You can lower your nameplates. I declare the voting closed. The Secretariat will now move to counting the votes. This process can take some time, and I would ask delegations to stay in the room during this time. Thank you.
Merci de votre patience.
Thank you for your patience.
Le résultat du vote
The result of the vote is as follows.
Nombre de membres ayant le
Number
droit de
of
vote
members
53.
with the right to vote 53.
Nombre de membres absents
Number of members
13.
absent 13.
Nombre de membres présents et votants
Members present
40.
and voting 40.
Majorité requise
The
21.
required majority 21.
Nombre d'abstentions 0.
Abstained
Nombre de voix
0.
pour 38.
In favour 38.
Nombre de voix contre 2.
Against 2.
La proposition est donc
The proposal is
adoptée
therefore
par 38
adopted
voix
by
contre
38
2 avec
votes to
0
2
abstention.
with 0 abstentions. Thank you.
Comme je l'ai expliqué
As I explained at the beginning,
maintenant procéder
we will now
au deuxième vote.
proceed to the second vote.
Je déclare donc
I
ouvert
therefore declare open
la Tchéquie.
Czechia.
Honorable Chair, Regional Director, colleagues, I speak on behalf of the European Union and its member states. Tuberculosis causes a major public health burden in our region. We are all committed to end this disease, and we need the regional action plan to achieve this. It is our responsibility to make sure governments have action plans available. However, we can only ensure united adoption if we are able to negotiate and to hear each other's views. Only then we can put our differences aside and reach consensus. This opportunity was not provided. Furthermore, during the past days, no member state has indicated their wish for further consultations on this resolution. The European Union and its member states wish to express our disappointment that a vote has been called in this regional committee on a resolution in a substantive agenda matter. We condemn in the strongest possible terms the Russian Federation's unprovoked and unjustified military aggression against Ukraine. Our thoughts and support are with the Ukrainian people, and we endorse the particular focus the Euro Secretariat has on their needs in this action. It is the only logical response for WHO to the war. We are therefore in great support of the regional action plan and of the references related to the health challenges in Ukraine and neighboring countries, namely continuity of TB treatment and necessary healthcare services, leaving no one behind, especially the most vulnerable. We regret the need for a vote, but we welcome this document as a step forward on this important agenda. Thank you.
Merci la Tchéquie.
Thank you, Czechia.
J'ouvre donc maintenant
I therefore now
le
open
deuxième vote
the second
que je vous ai
vote
annoncé.
that I announced earlier.
J'aimerais rappeler à toutes les délégations
I'd like to remind all
que les travaux
delegations
ne peuvent être interrompus que pour des motions
that
d'ordre liées au
our work
déroulement
can be
effectif
only
du
interrupted
vote.
for questions of order linked to the way the vote is proceeding.
Je déclare donc
I therefore
le vote ouvert.
declare the vote open.
Les délégations souhaitant
The
voter en
delegations
faveur
wishing to
de
vote in
la
favour
résolution sur le
of the
HIV
resolution
contenu dans le
on
document
HIV in document Euro RC72 Conf
Rev 2
6 Rev 2,
sont priés de lever leur
please
pancarte
raise your
ou
nameplates
d'utiliser la fonction
or
lever la main
use the raise hand
et de les
function
maintenir levés jusqu'à ce
and
que je donne
maintain
le
these
signal de
upheld
les abaisser.
until I give you the signal to lower them.
Merci. Vous pouvez baisser
Thank you. You can lower your nameplates.
Je vous invite à baisser vos pancartes.
I would invite you to lower your nameplates.
J'invite maintenant les
I now invite delegations who wish to vote against the resolution on HIV in document Euro RC72 Conf 6 Rev 2.
à lever leur pancarte
Please raise your nameplates
ou à utiliser la
or
fonction lever
use
la
the
main
raise hand function
et à les maintenir levés jusqu'à ce que je
and
donne le
maintain these
signal de les
upheld
baisser.
until I tell you to lower them.
Merci. Vous pouvez
Thank you. You can lower your nameplates.
J'invite maintenant
I will now invite delegations who wish to abstain.
à lever leur pancarte,
Please
à
raise
utiliser
your
la fonction
nameplates,
lever la main
use the raise hand function,
et à les maintenir levés jusqu'à ce
and
que je
keep
leur
these
signale de
upheld
les baisser.
until I give you the signal to lower them.
Merci. Vous pouvez
Thank you.
baisser vos pancartes.
You can lower your
Je
nameplates.
déclare le vote
I
clos.
declare the voting closed. The Secretariat will now move to the vote count. This process can take some time, and I would ask delegations to remain in the room during this time.
Je demande à la Turquie si elle a un point d'ordre sur le déroulement du vote.
Turkey, do you have a point of order on the way the vote is being run?
Indeed, it's not a point of order. I just wants to explain our position. We didn't vote for the resolution.
Merci. Je vous donne la parole.
Thank you. I will give you the floor as soon as I have announced the results of the vote.
Okay.
Merci.
Thank you.
Du vote
The result of the vote is as follows.
Nombre de membres ayant le droit
Number
de
of
vote,
members who have the right to vote,
53.
53.
Nombre de membres absents,
Number of
13.
members absent, 13.
Nombre de membres présents et votants,
Members
40.
present and voting, 40.
Majorité requise,
Required
21.
majority, 21.
Nombre d'abstentions, 0.
Abstentions, none.
Nombre de voix pour,
In
37.
favour, 37.
Nombre de voix contre, 3.
Against, 3.
La proposition
The
est donc
proposal
adoptée
is therefore
par
adopted
37 voix
by
contre
37
3,
votes to 3
avec 0 abstention.
with no abstentions.
Je me tourne vers la Turquie.
Turn to Turkey, and you have the floor.
Thank you, Madam Chair. I just want to explain Turkey's position. We didn't vote for this resolution because we already declared our dissociation from that resolution, so we didn't think it's moral to vote for in favor of or against such an important document. Thank you.
Merci la Turquie.
Thank you, Turkey. The floor goes to Czechia.
Honorable Chair, Regional Director, colleagues, I speak on behalf of the European Union and its member states. AIDS, viral hepatitis, and STI still cause a major public health burden in our region. These diseases continue to impair quality of life and cause premature mortality with new infections on the rise. We are all committed to end this, and we need regional action plans to achieve this. It is our joint responsibility to make sure governments have these action plans available. It is the responsibility of the governments to decide if and how they want to make use of them. We can only ensure united adoption if we are able to negotiate and to hear each other's views. Only then we can put our differences aside and reach consensus. This opportunity was not achieved. This is one of the reasons why we arrived at the point that we had to vote on this technical evidence-based document. This is of our great concern. We condemn in the strongest possible terms the Russian Federation's unprovoked and unjustified military aggression against Ukraine. Our thoughts and support are with the Ukrainian people, and we endorse the particular focus the Euro Secretariat has on their needs in this action. It is the only logical response for WHO to the war. We are therefore in great support of the regional action plan and of the references related to the health challenges in Ukraine and neighboring countries, namely continuity of HIV treatment and necessary healthcare services, leaving no one behind, especially the most vulnerable. We regret the need for a vote, but we welcome this document as an important step forward on this important agenda. Thank you.
Merci la
Thank you very much, Czechia. I do not see any other member states requesting the floor to explain their vote. Therefore, I declare this agenda item closed, and thank you for the debate we have had.